and I'm trying to say your dog has generalized anxiety, and we most likely need to consult with a vet behaviorist. Trainers can do a lot in terms of fear, stimulus, fear. Let's get them to interpret and feel better about the stimulus, tolerance and pattern and exposure, all that shit. But when it comes to generalized anxiety, and that being a main mechanism for the dog to push over into various fear responses, whether it's redirection when a kid is petting it or the slightest little movement, the slightest little sound, yes, fear is the tipping point, but the real problem is this buffer of anxiety that's caused the dog's threshold to lower severely. And so most likely this dog had generalized anxiety its entire life, was showing different. Classically, people think that like fearful dogs are cowering in the corner with their ears back. But when they were talking about how the dog would run around in circles and flop onto its back and release its bowel, its bladder, he said that was a famous thing that the dog did into adulthood, like moving around, running around the room in circles. It can be overstimulation, it can be panic. This dog, the board and train, is doing that, uncomfortable with the home environment, and it's just spiraling in the room and rolling down on its back. Those aren't good things. It's a dog that's uncomfortable with its environment and overstimulated and anxious. And so, unfortunately, the new dog coming into the home created more anxiety and produced a couple bites. And so the prognosis here is that we need to get a vet behaviorist involved. There needs to be an assessment to see what Sophie Lou says. If she does confirm generalized anxiety, then the dog can be put on a medication protocol, and then we can start a process of getting the dog more comfortable with its space, the dog in the home, kids. Or the owner has the option of fostering, surrendering to the rescue organization, and then fostering this dog until the rescue finds a new home for this dog. And maybe a quieter home is what's on the menu if it is generalized anxiety and there's been a tipping point with kid activity and the new dog and commotion is unsettling. Maybe that's the best option in terms of quality of life. But there still needs to be some sort of process in play to help the dog, teach the dog to take space when it's feeling uncomfortable versus running into your lap and redirecting while it's spiraling. Any questions?